Houston Methodist Hospital is one of the largest hospitals within the Texas Medical Center. I believe that Texas Medical Center is one of the largest centers in the country, if not in the world. It combines expertise of many different specialties located in one area in Houston. The Center for Liver Disease and Transplantation was brought about in response to a strong need for management of liver disease in the state of Texas. Texas is the second largest state in the incidence of liver disease and liver cancer after Hawaii. Our center brings about several disciplines together in order to provide leading management of those diseases like liver cancer, fatty liver disease, liver transplantation, management of hepatitis C, management of alcoholic liver disease. In the Houston Methodist, we have a very large transplant program that includes lung transplants, heart transplants, kidney transplants, liver transplants. So one of the strengths of a program like this is to be able to perform multi-organ transplants. But the Center for Liver Disease and Transplantation at the Houston Methodist has experienced exponential growth over the last 5 years. On average, at the present time, we do about 70 transplants a year, and I believe we'll become the largest center for treatment of liver disease in Houston.
Texas, Oklahoma, Mississippi, and Arkansas lead the nation in liver cancers, in mortality from liver cancers. Texas is probably number one. What we're seeing is an epidemic in hepatocellular carcinoma. What we need is early identification with screening programs, and then these patients usually fall into either surgical resection or transplantation. We have combined transplantation with innovative uses of sorafenib, which is a specific tumor targeting therapy, and have had excellent results. With cholangiocarcinoma, we have adopted the Mayo protocol, which is a combination of radiation therapy and chemotherapy. We have tweaked our chemotherapy under the guidance of some of our oncologists, and that has given us some extended survival rates.
Alcoholism is certainly a leading cause of liver disease in the state of Texas. I believe that because of the expertise we have here at the medical center and with hepatology staff, that we have our sensitivity to treating alcohol and alcohol-related problems, not only from a medical standpoint, but also from a psychosocial standpoint as well, and providing transplant services. Most patients with alcoholic liver disease, we would like for them to go to rehab before transplant. And sometimes that's not possible. So in selected patients, along a strict adherence to a protocol, rehab services after transplant, and still be able to maintain a very low recidivism rate post-transplant, which is the goal, if you will, in trying to break that habit of alcohol consumption.
Hitherto, fatty liver disease has been quite a difficult disease to treat or manage. And in our program, we've actually instituted a fatty liver program where there's a multidisciplinary approach to taking care of patients with fatty liver disease. In our fatty liver disease clinic, we have endocrinologists working with hepatologists and surgeons in taking care of a very complicated disease in patients awaiting liver transplantation. The Houston Methodist Transplant Center has been making use of what would term high-risk donors, increasing our donor pool by using deceased donor transplants. Given that we are in a big metropolis, Houston, as compared to New York or LA, actually does transplants on patients who have high MEL scores above 30 or 40. And with these innovative approaches, we're able to help our patients who are sick and in dire need of a transplant.
MITE is the Methodist Institute for Technology, Innovation, and Education. It's a one-of-a-kind, world-class resource for the retooling and training of physicians in practice. We're a hands-on simulation center. There's nothing like getting a device into your hands and doing that brain-hand connection to let you learn how to use that device safely.
So I see a real acceleration in trying to find solutions for liver disease. And we are positioning ourselves at the Houston Methodist Liver Center and the J.C. Walter Transplant Center to really be at the forefront of this by increasing our emphasis on research really trying to figure out where the potential solutions are going to come from.
Combination of research and clinical practice provides the best ways of serving our patients, in addition to education. Research includes both genomics, translational studies, and clinical research in collaboration with other hospital systems within our medical center.
I think the idea here is to put people with different expertise, different experience under the same roof where people can collaborate. And here we have nanotechnology, we have inflammation, we have epigenetics. So that creates a fabulous environment for collaboration.
You need to have a strong management team, a committed hospital, and resources to be able to provide the best care to patients. And that is what the Houston Methodist is all about.